Hi, this is Eric Young from Valtenson Bruner Financial Planning. I'm here today with Danielle Schamp, who is our health insurance expert. She's going to be covering paying for health care during retirement for ages 65 and up.
Hi everyone. As Eric mentioned, my name is Danielle Schamp. I am with Schamp Insurance Group. I am an independent agent, which means that I work with many different carriers. I am not licensed with just one. I'm licensed with many throughout the state of Minnesota. As Eric said, today we will be talking about paying for healthcare during retirement if you are 65 or older or on Medicare. We will also be doing a segment on pre-65 health insurance after retirement, but this is specifically for those who are on Medicare and are retiring. Okay, so as I mentioned, there will be a segment as well for health insurance before age 65. Today we will be talking about age 65 and up, so for those of you who are on Medicare, who will be on Medicare when retiring. And then lastly, Eric will also touch on long-term care needs and some considerations around financial planning towards the end. Okay, so there are two ways when you are age 65 or older to receive health insurance in the United States. One is through Medicare. So for those of you who are no longer working, don't have a spouse who's actively working, you are likely on Medicare as long as you qualify. You also may be working past the age of 65. There are many more people who are starting to work past that age of 65, and they continue on with their employer benefits, whether that be through their own employer or a spouse's employer benefits. So those are the two main ways that people who are above the age of 65 will have their health insurance covered. Right now, what we're going to do is go over some of the fundamentals of Medicare. So we are not going to talk about any particular plan, just kind of talk about Medicare basics, essentially, and what you can expect from the Medicare system. This slide is just kind of high level, the two different ways you can get Medicare, either through original Medicare and a supplemental plan or a Medicare Advantage plan. We will go into that a little bit more later on. A few important enrollment periods to be aware of with Medicare. The first one is your initial enrollment period. This is a 7-month window surrounding your 65th birthday. So for example, if your birthday is July 5th, your effective date for Medicare will probably be July 1st, which means that you have April, May, and June, as well as July, August, September, and October for your enrollment window, your initial enrollment window. There's also the annual election period. Many of you may be aware of this from either spouses or family members on Medicare. This enrollment period runs between October 15th and December 7th, and it's a time for those people already on a Medicare plan to make some changes to their plan for the following year. And then lastly, a special enrollment period. This is a pretty common enrollment period, specifically for those who have worked past the age of 65 or had a spouse who has worked past the age of 65 and they're now retiring. That is a qualifying event or a special enrollment period to get on Medicare and a coordinating plan at that point. Here is just a picture of the Medicare card. Many of you probably have already seen this. It has changed in about the last 5 years, but this is what the Medicare card looks like now. It has your name, your Medicare number, as well as when your Part A and your Part B, as in boy, of Medicare benefits began. So how to enroll in Medicare? If you are someone who's already collecting Social Security, when you turn 65, you'll receive your Medicare card automatically in the mail about 3 months prior to your Medicare effective date. If you are not collecting Social Security when you turn 65, you do need to be proactive and take one additional step by going to SSA.gov or Medicare.gov and signing up for your Medicare benefits. Again, you can do this about 3 months prior to your Medicare effective date, which is the first of the month of your 65th birthday. We're going to touch on these briefly, but of course, when we work together, I'll certainly guide you through these a little bit more. But just for today's purposes, Medicare Part A can be thought of as your hospital benefits. So it's going to cover anything inpatient hospital. So when you're admitted to the hospital, any prescriptions you're given in the hospital, surgeries, meals, that is all covered under Medicare Part A. You generally do not have a premium for Part A. So that's what you worked all of your working years, you paid into the Medicare system to pay for this Medicare Part A. So most are eligible for a premium-free Part A. Now there are some costs to Part A if you do end up in the hospital. I'm not going to go into too much depth on these actual numbers just because for those of you and most of you who will choose some type of coordinating plan like an Advantage or a supplement plan to go along with Medicare, these numbers will really not be applicable to you. You will have other figures that take its place depending on the plan you choose. Part A also offers some limited coverage for home health care, hospice care, and care in a skilled nursing facility as well. Medicare Part B, this is going to be hopefully more of what you're using more often. Office visits, diagnostic lab tests, preventive care like your annual wellness visit, limited cancer screenings like your mammogram, pap smear, colonoscopy, durable medical equipment like diabetes supplies, oxygen tanks, those types of things. Now, Medicare Part B does have a premium associated with it. The standard premium in 2021 is $148.50 per month, and that will be taken right out of your Social Security check if you're collecting Social Security. If you are not taking Social Security when starting Medicare, Medicare will bill you quarterly for that Part B premium. On the next slide, we will touch briefly on how you may pay more for your Medicare Part B depending on your income. Medicare Part B does have an annual deductible of $203, but again, just like many of the costs associated with Part A, that deductible may or may not be applicable to you depending on the type of plan that you purchase to go along with your Medicare benefits. Here's what I was referencing in terms of Medicare Part B and D, as in drug. It's called IRMA. It stands for Income Related Monthly Adjustment Amount. So what this is Medicare looks at your modified adjusted gross income from 2 years ago. So in this case, if you're getting on Medicare in 2021, they will be looking at your 2019 tax return. And you can see here, I won't go over into too much detail, but you can see depending on your income threshold, whether you file individually or jointly, if you are filing, let's say for example, jointly here, a tax return between 176,000 and 222,000, instead of that standard premium of $148.50, you will now be paying $207.90 for your Medicare Part B as in boy premium. That also funnels through to the Part D as in drug side. They do add an additional premium, if you will, to your prescription drug plan as well. This is constantly adjusted. So for 2022, for example, they will be looking at your 2020 income. There are also ways of having this IRMA adjusted if you have had a life-changing event. Maybe you've stopped working or something of the like. So if that is something that you think might apply to you, if you've quit working and now your income maybe isn't as high as it was 2 years ago, certainly reach out to me or someone from Voltenson Bruner Financial, and we can help you get the right forms to fill out and send into Social Security to possibly get that dropped and reduced. Okay, really briefly, some services not covered by Medicare. There are preventive and routine care services that you might imagine would be covered by Medicare, but are not. For example, a routine eye exam, routine hearing exam, dental, eyewear, those things are not covered by Medicare. They may be covered by some of your additional plans that you purchase, but by original Medicare, they are not covered. Outpatient prescription drugs, those are not covered. That would be your Part D or your prescription drug plan, which we'll talk about as well. Any care received outside of the United States is not covered by Medicare, as well as long-term care. I do have the last one in bold because I personally believe it's one of the more important reasons to buy some type of additional coverage beyond just kind of original Medicare. Original Medicare does not have an out-of-pocket maximum, meaning that if you had a really bad year, your costs could continue to accrue. There's no stopping point like many of your employer plans that would say, okay, John has now spent $3,000 out of his pocket, he's now covered at 100%. That does not exist with original Medicare. You will find that that exists on most Medicare Advantage plans and supplemental plans. So that is one reason, and in my opinion, one of the biggest reasons to consider additional coverage beyond original Medicare. Okay, so we have talked about Medicare Part A and B, and as you'll notice here, those are provided by the federal government. You don't really get to select a certain type of Plan A and Plan B. It is just the same for everyone. Where you do have some choices is when it comes to Part C and Part D, the prescription drug and the Advantage plan side of things. I won't go into too much detail about these today, just for purposes because it really does vary quite a bit person to person. So I want to be sure that we have a conversation around what's important to you and help you find the right plan for your needs. So that is certainly something that I'll help guide you through when it does come time to retirement and finding the right plan. So Part C, you might have heard of before. It's also known as a Medicare Advantage or a Medicare Advantage prescription drug plan if it includes the prescription drugs as well. It must cover everything Part A and Part B covers, and sometimes they cover additional things that Medicare doesn't. So for example, the dental, the eyewear, the vision. These are plans that you purchased from private insurance companies, which are the plans that I work with. So you can't buy a Medicare Advantage plan like a Medicare branded Medicare Advantage plan. So your Advantage plans might be through companies like Blue Cross Blue Shield, UCare, Medica, Health Partners, Humana. Those are all private insurance companies that offer Medicare Advantage plans for you to choose from. Same thing goes for Medicare Part D, as in drug. Okay, prescription drugs are not covered by Medicare. However, they do set a lot of the rules and regulations around Part D, as in drug. All prescription drug plans have a set formulary, which is a list of medications that they cover, and they categorize them into different tiers. So you'll see some medications are tier 1 and 2. Those are usually generic medications. Tiers 4 and 5 are usually brand. And then lastly, tier 5 is usually specialty medications. Those are usually the more expensive medications that you might have to get at a specialty pharmacy. Again, these are purchased from private companies that are contracted by the federal government. They do generally have a monthly premium. And one thing you all might be aware of, maybe not, is that if you do not select a Part D, as in drug plan, when you're first Medicare eligible, there can be a penalty that starts to accrue over the time that you do not have one. Now, of course, if you have credible drug coverage elsewhere, for example, through an active employer plan, many times that penalty does not apply to you. But you do need to ensure from the time that you technically are eligible for Medicare, which is 65 for most people, that you do have credible drug coverage somewhere, whether that be through an employer plan or a prescription drug plan. All right. Really briefly here, some people will qualify for low-income subsidy, which is help paying for their Medicare plans. If you think that any of these might be something that you might qualify for, or maybe you have a family member or friend who may qualify for it, my recommendation would be to reach out to the Senior Linkage Line. They're a resource here in Minnesota that is extremely helpful. I've had quite a few clients use them before. They have access to a lot of this websites and systems to be able to tell you what you would or would not qualify for. All right, some things to consider here as you either get on a Medicare plan or even every year during open enrollment when you have the opportunity to change Medicare plans. One would be your monthly premium, out-of-pocket maximums, provider network. Those vary a lot plan to plan. So you might have a network that's a little more narrow with some plans, where some carriers offer very broad and large networks. So that's something to take into consideration. The formulary for the prescription drugs, make sure that your medications are covered on this. Travel benefit. So some people do a lot of traveling, some maybe not so much, but just making sure that the travel benefit fits your needs. And then of course, many Advantage plans are starting to offer these, what we call value adds. So Silver and Fit or Silver Sneakers, those are the gym memberships that are oftentimes at no cost to you, added on as a benefit. Eye and hearing exams, eyewear and hearing aid allowances and discounts. And one thing that's not on here that's a big one for a lot of people is dental. So a lot of these Advantage plans are starting to incorporate some type of dental benefit as well. These are not things by any means that I expect each person to go out and research on their own. Really, that's job security for me. That this can take a lot of time if you're not really well versed in this. So if you would like some assistance in comparing plans and really narrowing it down from the 40 plus plans available in Minnesota to maybe 2 or 3 that are right for you, that's really where I come in. So feel free to reach out to me. We'll have a little conversation about what is important to you, what medications you might be on, what doctors you use, and I'll help narrow that field of plans down to a few to really focus on and look at. Here's really briefly, again, this is going to vary person to person, so I don't want to focus on this too much, but this just gives you an idea between a Medicare supplement and a Medicare Advantage plan, what you might be looking at in terms of premium differences. And this is certainly something that I really focus on with people, is deciding between whether they either want a Medicare supplement or a Medicare Advantage plan. You can see that the monthly premium amounts vary quite a bit. So on the supplement plan, you might be getting close to $400 a month when all is said and done. On these Advantage plans, you might be looking at closer to $250 or so. If that were all it was, everyone would go with an Advantage plan, right? But there are certainly some advantages to supplement plans as well that make them more expensive. So that's something we will certainly have on a more one-on-one conversation to decide which one is right for you. All right, and here, these are just kind of an idea, is if you were on a supplement plan, what your annual cost would be. It just breaks it out a little bit more if you wanted to add on things like a dental plan and a vision plan and things like that. So these are more so just resources for you to hang on to in case you wanted to take a look at them. And same for a Medicare Advantage plan. You'll see some of the costs associated with an Advantage plan as well over the course of a year. All right, and here's where I'm going to hand this back over to Eric. He's going to touch on some long-term care insurance as well as some financial considerations when making these decisions. But as I mentioned, feel free to reach out to me. Voltenson would be happy to share my information with you. Otherwise, my information is at the end of this slide deck as well. So feel free to reach out if you have any questions. A good time frame prior to retirement will likely be about 3 to 4 months prior to retirement for us to meet and really focus on what forms need to be submitted, what the process needs to be, and go over specific plans for your needs. So thank you very much for having me, and hopefully this was helpful, and hopefully I look forward to working with you down the road. Thank you.
Thank you very much to Danielle for going over all of those items. One of the things that we look at when we are doing financial planning for clients is looking at long-term care costs and expenses. We look at 3 different areas on whether or not it makes sense to self-insure, take out a long-term care insurance policy, or there are life insurance policies as well with long-term care riders. When we look at your overall financial plan, we look at each one of these areas and we make sure that we are accounting for the costs that you are going to be incurring when you get to the point you might need long-term care. And every situation is different, so you can certainly contact us and have that discussion and see what fits best for your needs. Also, financial planning considerations. It's always good, and it's always something that we do if you're working with us. We take a look at your retirement analysis and the cash flow in retirement to make sure that you're preparing for healthcare costs. And another great tool to use, which is kind of a triple threat. It's got tax deductions, tax-free growth, and you can take money out tax-free as well as a health savings account or an HSA. We always recommend, if you have one of those plans available, to take advantage of that. Diversifying the taxation of investments. Everybody, again, is different. Every situation is a little bit different depending on what income tax bracket you're in, whether it makes sense to allocate some of your retirement savings to Roth or after-tax accounts, or maximize the tax deduction with pre-tax dollars whether it be in a 401k or 403b or IRA. We also, the health insurance options that might work for other people, that might work for your friends or other relatives, might not necessarily work for you. So that's where we bring Danielle in as well. And she is wonderful at examining all the different types, and she's very knowledgeable with all the different types of health insurance plans that are out there. So to conclude, here's some useful resources that we recommend to people that if they want to get some more information, whether it be on Social Security or Medicare or other senior planning. That's all for now. So we want to thank you for your time. If you have any questions on anything that we discussed today, please give us a call. Our phone number is on this slide. You can also contact Danielle at this number as well, and we can help you get in contact with her and set up a meeting with her. She does meet with clients here at our office.